Dr. Fauci, thank you so much for joining us. When I think of the pandemic, the COVID pandemic, I think of you day after day, week after week, um, month after month, being the public face we turn to. And journalistically, I think of Helen as someone that millions of our readers turn to for her coverage, for her what I thought was pretty prescient coverage of what transpired over those months and years. And but we have a whole career, your whole career to talk about much more than COVID. So why don't we just start with that? And let me just turn first to Helen for your any questions or takeaways from the book.
Well, I was struck as I was at the end of the book. You talk about the fact that as you were leaving the NIH campus on your last day as director of the National Institute of Allergy and Infectious, or for Allergy and Infectious Diseases, that, you were thinking back to when you joined the NIH, and you said, I expected a fulfilling but quiet and predictable life conducting research and treating patients. So how'd that turn out for you?
Not quite, Helen, not at all. And I think one of the lessons that I try now as I reflect back when I talk mostly to younger people, including in my current position at Georgetown University, when most of what they want to know from me is my perspective on directions of career, that certainly my career was not linear in the sense of going in the direction and to the goals that I thought, because I really came down to the NIH for a fellowship in infectious diseases and immunology with the stated purpose of returning back to New York City and getting on the full-time clinical research hospital staff and essentially seeing patients in an office somewhere on York Avenue or First Avenue and 68th Street in Manhattan. I really, really wanted to do that. And something happened on the way to that. And that was in my 3 years in my infectious and immunology fellowship at the NIH, I got introduced into the world of research, which was brand new for me. I'm not an MD PhD. I mean, I'm very well trained in multiple years of medical residency and fellowship, but I had not had any research training. And I really got bit by the research bug, particularly the interface between basic and clinical research. So that's what I meant as I was driving out. I said, boy, is this really different from what my intention and my goal was when I drove onto that same campus in the summer of 1968.
Let me mention in your acknowledgments, you mentioned Wendy Wolf, your editor, as being extremely talented and tough, and she has that reputation. And the book is tightly written, but I think of all the chapters that you didn't write that could have, if you could do 3 volumes, there's a lot you could say. So what was the hardest? I think you said something like, she said, cut that out, even stuff that you wanted in there. What kills you the most in terms of like, I really wanted this anecdote or this story in the book?
Well, there were several, Rick. The one thing I learned, I've written a lot of scientific papers, and I try to be as concise and accurate in that. But I really learned an awful lot about editing so that you have a good flow to the manuscript. And there were things I wanted to include in there. We have a sort of a culture in medicine and science that you have to be very careful about making sure you give credit to people who collaborate with you, people who maybe gave you an idea about an experiment, and you want to mention them, maybe put their name on the paper as an author. One of the most difficult things was not describing in detail every person that was at every meeting that I went to, and every single meeting that I thought had an impact, which according to Wendy and my collaborator who helped me edit it, Linda Coleman, that was fine, but nobody's interested in that but you, namely me, Fauci. So I had to learn that I'm very sensitive about hurting people's feelings. That's just my character, about feeling that, I didn't give them their due respect. So I had to not mention many things and many people, only because the flow of the book, as you said, it's a very tight book. I mean, I believe, I'm prejudiced, that it's a really good, quick read because it flows very well. I think had I included all of those things that I wanted to include, it may have been a little bit diffuse and maybe taken away from the flow, you know?
Bes- Besides the giving credit and adding more names and people, was there anything that you really went to push it? Like that anecdote for history's sake needs to be
Yeah.
in.
Well, I wanted to, but Wendy had three things that had to go. She said, "We'll keep one, but two had to go." And,
And
the one I wanted to keep was a private dinner that I had over Mike Gerson's house with President George W. Bush and Laura, my wife Christine, and I, and Mike Gerson, who, as you know, is a very, deceased now, but is a very well-known columnist for the Washington Post, as well as the speechwriter for George W. Bush. It was just a really interesting evening spent with the President of the United States in a very informal, not press conference way. And I just thought it would have been kind of neat to include a discussion of that dinner that we had. Wendy was absolutely against that. She said, "It has nothing to do with the theme of your book. Cut it."
what what was it? Was it the most memorable dinner of your life?
Rick, I can't say what's the most memorable dinner because I've had a lot of dinners with people, and I'll probably say it was one of the, and then I'll remember three others that were maybe more important. My dinner with Bono, right, literally as I'm pointing here on my deck in my back porch in Washington D.C. the night he came over my house and we started talking about, when I couldn't tell him about PEPFAR because the president did not want me to tell anybody, but I felt so uncomfortable because Bono was so passionate about doing good for the developing world. And I would love to say, Bono, we're working on a transforming program that I can't tell you about. But that aside, that aside, it was a great dinner.
Yeah, I was impressed that you cooked for him.
I did.
Yeah.
It was kind of fun. It was really fun.
Let's, Helen, yeah, I see you're about to jump in.
Well, I mean, there's also the dinner with Yogi Berra. Let's not forget Yogi Berra.
Well, yeah, that's why I said, Helen, if I said that dinner A was the most memorable, I'll immediately think of three others that were, you're right. It was a different kind of a feeling. I had idolized Yogi Berra since the time I was like 6 years old, literally in elementary school at Our Lady of Guadalupe in Brooklyn. We used to know what his batting average was every single day. That's how I excelled in math. I was able to figure out batting averages based on how many times at bat and how many hits he got. So I would know even before the newspaper came out what his batting average would be the next day. Yeah, that dinner with Yogi Berra was absolutely phenomenal to be able to chat with the person that was my boyhood hero.
Let me jump to another person in your life who was a more complicated relationship, as you say in the book, and that's Larry Kramer, the famed AIDS activist. And I had a little personal dealings with him when I was in the 80s. At the New York Times as a reporter, he would badger me on the phone. Why aren't you writing about Reagan and AIDS? And it wasn't my beat, and it wasn't. I thought, who is this guy calling me? And then years later, at Stat, I did an interview with him, and I forgot what the point was. It was 2018. I can't remember what the reason was, but I did a Q&A with him, and I asked him about you, and he said he called you the consummate manipulative bureaucrat who speaks out of too many sides of his mouth. And then I thought, oh my God, I got this great sort of pissing match between Fauci and Kramer. So I sent you an email, and you instantly got back to me, and you said, Tony's a friend and a hero. And I thought, what? That totally unsettled me. And I think And I, as I read the book, it seems like a trademark of yours throughout your career. You always keep your cool. You don't let anyone get to you. These people that one would think are your enemies, or you say they're your friends. So I guess two things. What is your secret in dealing with people, and is that how you've lasted so long in Washington?
You know, Rick, it's a complicated issue, and I don't know if it's a secret, but it's a way I approach people who oppose me and attack me. I always listen. Is there a kernel of truth in what they are saying, and is their attack on me something that I could really say really isn't personal because they're trying to make a point. And that was very clear with the activists, that I was listening to what they were saying, and so much of what they were saying was making perfect sense. And I throw in there a bit of, I think I have a strong sense of empathy, particularly for people who are suffering, physically, mentally, and otherwise. And and I understood what Larry was all about. He was very passionate about his children, as he called them. His children were the entire gay community. He kind of looked upon himself as the father figure of the gay community. And he was outraged that the government was not paying enough attention, number one. And number two, that he felt that we were not including them in the discussion. But Larry Kramer was very different from some of his so-called children, who were the act-up people, the Peter Staleys, the Mark Harringtons, the Greg Gonzalez's. They were much more intellectual. So his purpose was to break the door down so that they could walk in and talk to me. So he was sort of a firebrand that would often say things that he didn't really mean. And then we would have conversations after he would berate me. I described one of them in the memoir, where on a television interview, he just blasted me all over the place. And then when he went back to his Greenwich Village apartment, and I went back to my house in Washington, he called me up like within minutes of my walking in the door, and he said, "That was pretty good, wasn't it, Tony?" And I was thinking, like, what interview did you watch? You know? So he was a very unusual guy. And towards the end, as I described, when he became rather weak and a bit infirm, I visited him multiple times in his Greenwich Village apartment, and I even visited him when he was in a rehabilitation center and very, very, very weak. And I feel very fortunate that very soon before he died, we had that last conversation, which I described on the phone, which after all was said and done, we ended it with, "I love you." And he said, "I love you too, Tony." And that was one of the best conversations that I've ever had with anybody.
When you talk about your sort of the empathy, and you see others' points of view, did you share his concerns about his animus towards Ronald Reagan and not mentioning AIDS and so forth? Because I noticed in the book you kind of gloss over Reagan.
Yeah. Well, Rick, one of my characteristics, for better or worse, I don't really think animus is helpful, particularly in my job. The ultimate is, should I really, really be pissed off at Marjorie Taylor Greene for that ridiculous display at the hearing? No. I mean, I think when you have animus to some people, it sometimes clouds your thinking. I try to understand, though I felt it was inappropriate and not helpful and a missed opportunity for Ronald Reagan to not mention AIDS until his second term. I was disappointed in him, but I didn't have animus to him because I was trying to understand. He was trying to not create a kerfuffle with his conservative base, even though you knew deep down as a Hollywood figure that he had plenty of friends that were gay. And, you know, one of his best friends, Rock Hudson, died of AIDS. So he clearly had to be sensitive to it, but he made a decision, you know, which I think if he were back here and he had to do it over again, he probably would have done it a little bit differently and started talking about and using the bully pulpit of the presidency to call attention to this emerging outbreak.
That's probably helpful in keeping your sanity and keeping your like level-headedness in terms of not getting too angry at anyone. Or but I have to ask, you know, when you're during the bad days of Trump, you were not shy about contradicting him publicly, but in a very cool, like calm way.
Right.
Weren't there times when, and I know your wife, you said, was making sure that unlike the AIDS era, like that you got your full night's sleep and you were hydrated and all that, but weren't there stressful times when you came home to your wife and family and said, this guy what is he saying? Why am I like, didn't the anger ever come out privately?
You know, Rick, I have to be honest with you. No, I never got angry with him. I was trying, I was quite uncomfortable about publicly contradicting the president of the United States because of my profound respect for the office of the presidency. But there came a time when I said to myself, as I described in the book, that sooner or later I was going to have to speak out. And then once he, you know, started to say things that clearly were not true, that the virus would disappear like magic. And then when it became clear, because the epidemiology was very clear cut, that it wasn't going to go away the way flu goes away in March, and certainly by April. He had this innate desire to conflate influenza with COVID. He wished it was influenza. And he often asked me things like, why can't we use the influenza vaccine for COVID? And why is this any different from flu? And I kept on saying it's a very, very important difference. So once he realized that even though he said it was going to go away like magic, but it did not go away like magic, then he started to invoke magical cures like hydroxychloroquine. So then when the press would ask me, sometimes while I was standing there at the podium in the White House press room, and sometimes after the press conference, they would call me up and I would say, no, I'm sorry, I disagree. That hydroxychloroquine, there's no evidence that it works and it could be harmful. And no, by all parameters, the virus is not going to disappear like magic. I made that decision and I knew there would be consequences. There were unusual consequences, Rick, in that he was not particularly upset with me. Even right after I said that, he had this strange kind of feeling, which again, I can't psychoanalyze somebody, and I won't attempt to, but he really wanted to stay friends with me. You know, right from the very beginning, that New York City camaraderie, you know, where, you know, one guy from the Queens and one guy from Brooklyn, you know, we kind of understand each other. And even when he would call me up at night and yell at me the way I describe, you know, you got to be more positive. What are you talking about? You know, you're ruining, you're losing me X amount of effing dollars. At the end of each of those, he would say, are we okay? We're still okay, aren't we, Tony? It was sort of like, okay, I guess we're okay. It was an amazing conversation. The difference between that and his staff was that I was not okay with his staff, and they did not want to be okay with me. And that's why you saw crazy things like that USA Today editorial by Peter Navarro saying that I didn't know what I was talking about. And the comms staff, led by Kayleigh McEnany, who was, essentially doing opposition research on me and saying that I was wrong more often than I was right. That was the interesting conflict. It was only at the very, very end that, literally as we approached the election, when people started saying, fire Fauci, that he then start, speaking out more explicitly against me. But that's a long-winded answer, Rick. I never got angry with him. I never came home and told Christine, my wife, boy, this guy really is pissing me off. It was more like, what is he doing? He's losing an opportunity when the CDC came out and started recommending mask wearing for indoor congregate settings. And he gets up and says, well, the CDC recommends masks, but for me, I elect that I'm not going to wear it. I don't think it's right for me to wear it. He lost an amazing opportunity to get the country to be adherent to mask wearing. And by saying he was not going to wear it, he immediately made mask wearing a political issue. Because
Similarly,
yeah.
sorry,
Go ahead, Helen.
I was just going to say, similarly, when he didn't get vaccinated in public, I was stunned to see that a president in a circumstance like this would not have been photographed getting one of the first doses of vaccine. It was such a missed opportunity.
Absolutely.
And a signal.
Yeah, you're right. It was a missed opportunity, and it was a signal that if you're for masks, you're against me. If you're against masks, you're with me. And that's why in the general public, we used to see these scenes where people would be getting into fistfights about whether they were asking somebody to wear a mask or not. If the president of the United States said, listen to the CDC and wear a mask indoors, people would not be punching each other because they have a mask on.
On the pandemic, if we could for a sec, I'm curious to know when you really had a sense that this was going to take off. In the book, you talk about in late January being really alarmed when you saw that the Chinese were building hospitals in like a week. That you just don't do that kind of thing ever. So they must have had a real enormous need. But you may remember in mid-February, you and I were on a panel with Ron Klain and Nancy Messonnier at the Aspen Institute in DC. And I was trying to press you about whether or not COVID was going to become a pandemic. And you and Dr. Messonnier were talking about the risk to Americans being low. And within weeks, a few short weeks, it was quite clear that was no longer true. When did you know?
When I was saying the risk was low, I've always said, but that could change rapidly because people would say, what should we do now when there were no cases, maybe 1 or 2 cases? So when there's it may be a lesson learned, Helen, had to be much, much more explicit when you say the risk is low, but this could change. I've always said, but this could change quickly, but most people don't hear the but. I think if there's a lesson learned, they should say, but I think we're running the same thing now with the dairy thing. People, the CDC is saying the risk is low. They better make sure they say, but if that virus recombines with a highly transmissible flu, the risk is not going to be low. So that's one of the things with saying the risk is low. But anyway, in answer to your question, there was always this feeling that we have such a good system in this country that we could essentially, get our arms around it by identification, isolation, and contact tracing. And maybe there was something about what the Chinese were doing that they really were not able to do that, which was sort of stupid because that's assuming the Chinese don't know what they're doing. Once it got to New York City, and my colleagues in New York City were saying that this is really bad. Actually, it was even before New York City. I have a bunch of people who I trained, who went back to Italy.
Mm.
You know, since I'm an Italian American, I just had a bunch of Italians in my lab as postdocs, and they would go back to Italy. And when I saw what was going on in northern Italy, I said, wait a minute, you know, the Italians are very competent. They were getting overwhelmed. So if Italy is going to get overwhelmed, why do we think we're not going to get overwhelmed? And very soon thereafter, it hit New York, and then all of a sudden, it was clear what we were dealing with. So, in answer to your question, Helen, I think it was a combination of my being very concerned about the building of the 1,000-bed hospital by the Chinese, and immediately learning from my Italian friends that they could not control this. And when you know a country that's a developed nation like Italy can't control it, I think we're being naive to think we're going to do a hell of a lot better than they are.
Can I just follow up on the H5N1 in cows thing? You probably have heard Colorado has found a fourth case, a farm worker who had conjunctivitis, not sick in the classic flu sense, but tested positive. And as you point out, the messaging is very much the risk to humans is low. We don't hear the follow-up, but that could change, and that could change very quickly. And I think that that is something that the public does not understand, that the distance between the risk to you is low and we're on the precipice of something big could be a very short distance. What's your take, though, on this risk? First time really H5 has been seen in cows. People have interactions with cows. Barn workers could start going into barns in the fall with human flu strains that could reassort with this in cows. What's your sense of where this is heading?
Well, there is no mathematical risk level that you can give, Helen. You just can't. So, but that's why when they say it's low now, but I would really encourage them to do what you had just articulated. But the thing that you mentioned is the thing that worries me. I don't think that this is going to gradually adapt itself in its present form in the cows and then continue to intermittently infect the human. And then all of a sudden it evolves in a way that it infects a human and then it takes off because it increases its transmissibility. I worry about what you, I believe, alluded to, that one of the farm workers, the dairy workers, has a plain old H3N2 flu or an H1N1, gets infected with the H5N1, and all of a sudden you have a recombination of a highly transmissible flu with a degree of pathogenicity that is much greater than what you have with a normal flu. That's what my concern would be.
Go ahead.
Unless, Helen, you had a follow on that. Okay. I wanted to ask something else that's not in your book, but that you talked about in the CBS interview, which was offers from pharma companies to make millions of dollars. Can you, when was that, or was that all along for years? And what was the pitch to you to leave this job you've been doing for decades?
Well, it was over a period of several years, and the offers got bigger and bigger as I got better known and better known. And it was mostly someone who wanted you to be, the chief scientific officer for a salary that is multi times what I was making, but also with the stock option that if a product gets licensed, the amount of money you could make would be, almost unlimited. And I was getting offers like that from pharmaceutical companies all along. The other thing, which obviously you can't take with the government when you're a member of the government, is to be on the board of directors or the board of trustees of the big companies, which you can get a substantial salary with that. Also, some venture capitalists wanted me to join their firm to be the scientific advisor. Starting off with a flat, cold $1 million salary, followed by a certain percentage of any product that I advise them on that turns into a product, which if you do the math on that, that could be several millions of dollars per year. Yeah,
Did
and
you
that went along, just kept them getting bigger and bigger and better and better.
um did you do the math and think, sit down with Christine and think like this could be our life, a life changing
No,
thing?
Rick, I can say very honestly that I never gave it more than a second's thought. It's just not what I wanted to do, and I was very sincere when I explained going back to my childhood when my father was running his neighborhood pharmacy. He was a terrible businessman, but he imparted on me the feeling that material things really don't matter very much. He would, give away half the medicines that were prescribed because I lived in a working class neighborhood that wasn't particularly rich, and he would put it on a tab and often not get paid. And when as children, my sister and I would say, Dad, why are you doing that? We need the money as much as they do. And he would just say, that we're better off in many respects than they are. So, we need to be sensitive to their sacrifice. And that was really what I did all along. And my schooling was also service for others. So my whole idea was money is almost irrelevant. I mean, I know people would scoff at that and say, well, you're just saying that, but I never really thought of salary. I mean, when I was an intern and a resident, I didn't even know what my salary was. I never even asked anybody. You kind of got a check and they took the rent out from where you were sleeping. I never made that a big deal.
Related to all that, I mean, you talk with your great respect for scientists, researcher, academics, government servants, but I don't have a sense of what you think about pharma and the industry and their role in science and medicine.
Oh, I think it's an absolute essential role. I think that, what we did with the COVID vaccine, with Moderna and the other companies was such a classic example of the need to have absolutely public-private partnership relationships. If you look, Rick, at all the drugs over the years that got developed for HIV, that the collaboration between NIAID, when I was director, all the clinical trials we did through the AIDS clinical trial group to be able to show the efficacy and the safety of these drugs, I have a great deal of respect for that interaction between the pharmaceutical company and the federal government. What I would hope would happen, and that's, again, I don't get into the finances or the economics of it, but when they get a drug that they're making billions of dollars on, I think there has to be some way of getting those drugs available to the developing world in a way that they can afford it. I mean, it has to be two-tier pricing. I know people have a lot of arguments against two-tier pricing, but I think that that's in many respects a solution to getting these interventions to people who need them. But bottom line is, I am absolutely pro public-private partnerships.
Can I swing back to something you said a couple of minutes ago about your upbringing and what motivated you? You talk in the book about a life of public, that your career is one of public service. And, for a long time, that service was rewarded and appreciated. You were lauded publicly. You've won medals, presidential medals. You've met kings and world leaders and been advisors to a series of presidents. But, more lately, there's been quite a bit of a backlash. I think in part from people who are angry about the fact that they had to go through a pandemic, and other people who are looking for someone to shift blame for the pandemic on. And it's not just you. I mean, public health officials all over the place had a very hard time during the pandemic, death threats, all kinds of things, and a lot have left the field. Do you worry that we are setting ourselves up for a future in which not enough people will go into this area, either public service or specifically public health, because the rewards aren't there financially, and if they're going to be abused, why bother?
I'm very worried about that, Helen, because I already see that not only in people who are in public health and public service who feel I had enough of this, I'm being attacked, I'm being threatened, my family's being threatened, I'm being disrespected. And then when people who are considering going into public health and public service, they see what's happening to their peers and to their role models, and they say, that's not what I want to do with myself. So I'm very concerned that the backlash against science and scientists is deeply troubling to me. It's sort of almost paradoxical. In the beginning, when the courageous physicians and nurses were taking care of people who were desperately ill, there was a thing called the Fauci effect. And the Fauci effect was everybody wanted to go into medicine and health because they felt they were doing things that were important for the health of people. Now, the effect has almost been reversed because they look at these nurses and public health officials and doctors who are getting threatened, and they're saying, I don't want that for myself. So it's been a turnaround where it was first they were heroes and heroines, and then all of a sudden they were the object of scorn and attacks.
I know we don't have that much more of your time. I will ask you a couple of quick questions if I could.
Sure.
You've been through so many public health and scientific challenges, HIV, Zika, SARS-1, SARS-2, you name it. What are the things that keep you awake at night now? Like when you're looking into the future, what are the things you worry about?
Well, in my lane of infectious diseases, Helen, I'm as much worried about climate change as anybody else. But if I stay in my lane of emerging infectious diseases, before COVID, for literally decades before COVID, people used to ask me continuously, Tony, what is your worst nightmare? What keeps you up at night? And I'm on record multiple times saying, is a brand new virus that jumps from an animal species, a zoonotic, that is respiratory borne, that has a high degree of transmissibility, easily transmitted, and has a degree of morbidity and mortality, has to have a major impact on society. And my worst nightmare, and what kept me up at night, we've lived through it over the last 4 years. Unfortunately, Helen, my nightmare hasn't changed. And I'm talking about another respiratory-borne virus, whether it's another coronavirus or whether it's influenza, a pandemic form of influenza. But that, to me, is the most dangerous form of an emerging outbreak because, Ebola scared the hell out of everybody. But you and I know that you're not going to catch Ebola by sitting next to somebody who's been exposed in the subway or on an elevator. You have to be exposed to the body fluids of someone who's desperately ill. So even though Ebola is scary, we're not going to have a pandemic of Ebola in a developed country. But it is very easy to have a pandemic of a respiratory virus anywhere in the world, including in the developed world.
Rick, you must have a last question you want to get in.
Yeah, I wanted to ask you sort of an obvious question that's on the minds of everyone is, what did you think of the debate?
Obviously, it was very disturbing. I don't want to, as Helen knows me for so many years, get into anything that could be construed as being a political statement.
Right.
The only thing that I can say, Rick, is that I spent a lot of time in the Oval Office with Joe Biden, briefing him, sometimes once a week, sometimes every couple of weeks, in the 2 years that I was in the White House. And I don't know what happened on the night of the debate, whether that was he had a bad cold and he was fatigued from multiple time zone changes going back and forth across the Atlantic, going to LA and then coming back, and had a bad cold and somebody gave him an antihistamine. I don't know what happened, but what I saw on television was not the Joe Biden that I've dealt with. So I just can't say anything more than that.
Right. Well, one thing I related to that is another person who I also considered very measured about medicine and staying away from politics is Dr. Larry Altman, who, as you know, for decades covered presidential health at the Times. And he just wrote a piece for us that we just published today that says, I'm not going to be an armchair, doctor here, but the American people deserve to know. He should have an evaluation. The American people should know if there's a medical explanation for his performance. And I wanted to add, and not sort of just so people know what's going on. Do you think that's a fair ask?
I think it's a fair ask, but I was reading literally an hour ago in the, I guess it was in the New York Times and or the Washington Post, that Kevin O'Connor, his physician, said they explicitly tested him for Parkinson and he doesn't have Parkinson. That's the disease that everybody says, well, maybe he has Parkinson's. And Kevin O'Connor is a pretty good doc. I know the guy pretty well. He doesn't think that's the case.
But I mean, Larry would say that's good and fine, but if they did these tests like in February, people can change, and that people are owed sort of the most up-to-date recent medical evaluation.
Yeah. Rick, I'm reluctant to comment on that, because if it gets out that I did, it looks like, I'm all of a sudden being a doctor from a distance, and I don't like to do that.
Okay. Well, one thing, just to make it neither Trump nor like one way or the other, do you, just generally speaking, given that we have these two candidates at the oldest candidates we've had, do you think it's, and just I'll just for both of them, fair that we have recent medical evaluation?
Yeah, of course. I mean, but that's part of the way presidency should be run anyway. They get intermittent medical evaluations. I mean, that's been that way all along.
But when you say intermittent, what does that mean? Like every 6 months, or should it,
I think they do it every year, a full evaluation, and there's a physician with the president all the time. And that person is Kevin O'Connor, who's, good guy. I mean, he's a good doc.
And just looking ahead, what are your, and again, avoiding politics, but how do you see this country dealing with public health issues in a Trump versus Biden White House over the next 4 years? Do you see much different, or things we should be worried about or thinking about?
Well, I described in my book, in the last 2 chapters, the adherence to facts, evidence, and data on the part of the Trump White House versus the Biden White House. And I describe in some detail the variance from the truth about ignoring the epidemiology. It's going to go away like magic. Hydroxychloroquine works like magic, et cetera, et cetera. Whereas in the Biden White House, I was explicitly told by the president, we want to go with the facts, the data, and the evidence. And that's what we're going to report to the American people, the scientific truth. And when things change, or if we make a mistake, we'll correct that and always go back with the truth. So, I mean, I sort of came down on that pretty clearly in the memoir.
And let me see if I don't want to, like, Helen, do you have a final question?
Go ahead, Rick.
No,
He's
well,
my boss. I gotta let him.
no. I just reading the book, all the presidents you've served. The one that comes off as where you have the most affection and respect for seems to me George W. Is that true, or is that
Well, I think affection would be George H.W.
right? Right.
Yeah, but the fact that I was able to be the principal architect of the PEPFAR program of the George W. Bush is huge. I mean, that program saved 25 million lives. So if you're going to pick out a president, at least in my lane of what I do, he allowed me to put together a program and essentially listened to almost everything I said that should be in that program, from the number of countries to the amount of money to the use of condoms, all those things. He went along with it, despite the fact that he's a conservative Republican president. So to me, what was accomplished during the George W. Bush administration was historic. That doesn't mean that I didn't have great affection and great interaction with Clinton, certainly with Obama. We went through pandemic flu, Zika, and Ebola. I spend more time in the Situation Room, with President Obama than most any other president.
And of all these presidents, I understand they had strengths and weaknesses, but who had the best command of science and medicine?
Yeah, I can't say that, Rick. I don't want to come down on that. That's a soundbite I'm staying away from.
Can I just ask you, I mean, PEPFAR, the President's Emergency Fund, what is the rest of the acronym? I just know it by
the President's Emergency Plan for AIDS Relief.
Right. It changed the trajectory of the HIV epidemic in Africa. Not just Africa, but, specifically there. Are you worried about what might happen to it in a second Trump administration?
Oh, I'm very worried about what will happen to it in any administration. There's talk about cutting PEPFAR already. And the Congress has a lot to say about that, not just the president. So I'm afraid that there's an erosion of financial support for PEPFAR, which is such a highly successful program.
My final question, and that is, people reading this book, if you had to pick one takeaway about you, about Anthony Fauci, that you want people to know, what would that be?
Well, I thought about that a fair amount, Rick. And, people talk about legacies, and there are many aspects to my career because I wore multiple hats: a basic scientist, a clinical scientist, an institute director that led the development of drugs for HIV, a policy person, namely my impact on PEPFAR. But I will let others judge that. What I want people to get out of the book, which I hope comes loud and clear, that every single day I gave 110% every day. And, to use a sports metaphor, I just left it out on the court every day. I didn't leave. I didn't take anything off with me. I just, every single day, and let others judge what the impact of that was.
And I slipped something in quickly. I had the sense when I finished the book that when you left, you weren't 100% at peace with giving up this job that you so loved. Where are you on that now?
Oh, I'm very much at peace, Helen. Okay. I really am. I wanted to leave because I really wanted to get on with writing the memoir. I just felt I'm very energetic, thankfully still healthy, very passionate, but I wanted to get that done. But my role now at Georgetown is very gratifying. I'm right in the middle of the Georgetown campus. There's students all around. I advise them. I give them seminars. We have fireside chats. I give them career advice and stuff. It's a different thing than I've done before. So I have no regrets at all about having stepped down or when I stepped down.
Great.
Dr. Fauci, thank you for your time and this really, really interesting conversation. Really appreciate it.
My pleasure, Rick. Thank you for having me. And Helen, great to see you again.
And you, thank you.
All right, take care. All right,
Take care.
bye-bye. Bye.